It's been a stressful summer for Lisa Caponio.
Ciao mamma, come va? Tutto bene oggi?
Lisa's mother lives in a private aged care home in southeast Melbourne. Katerina, who has dementia, has endured 2 lockdowns since the start of December, with 10 days entirely confined to her room because of COVID outbreaks.
Day one was horrific. Something like about 15 phone calls I received. She calls to say, please explain what's happened, and she's deteriorating. Her voice is weakening.
Princeton View Aged Care says it followed directives from the Victorian Health Department as required during the outbreaks. Lisa Caponio is happy with the care her mum receives, but she's worried about ongoing lockdowns now Omicron is sweeping the country.
Mum's been triple vaccinated. The home that she's in has done an amazing job to keep them safe. But going forward, this is just not sustainable because these outbreaks are going to continue to happen.
In December, there were 36 aged care homes across the country grappling with COVID-19 outbreaks. That number escalated over the Christmas-New Year period, and by last week there were almost 500 homes with active outbreaks.
We are seeing an astronomic level of aged care COVID outbreaks. So we think that by the end of this week, we'll probably be well over a third, getting towards half of all aged care homes in Australia that will have been experiencing an outbreak.
According to the latest national figures, more than 1,300 aged care residents have COVID, along with more than 1,800 staff. 12 residents have died of COVID so far this year. Last year, 227 died.
It feels a bit like, we're a Groundhog Day, or that we're just repeating the same mistakes that we've done before.
While the government says it's committed to protecting senior Australians, the opposition argues the pandemic has revealed underlying systemic issues in the sector.
We have had 8 years of funding cuts and complete neglect of our aged care system. We've had a Royal Commission which told us things needed to change and nothing did. So the system was already on its knees. When you overlay Omicron onto that, what we have is an aged care system today in diabolical crisis.
In October 2020, the Royal Commission into Aged Care delivered 6 separate recommendations on dealing with COVID. The federal government accepted them all, providing an extra $450 million for COVID preparation and response, as well as for hiring extra staff to allow family and friends to keep visiting their loved ones.
Well, I think the lockdowns are symptomatic of a shortage of resources. It's also easier to be risk averse and shut down.
The aged care regulator received 45 complaints referencing lockdowns, isolation of residents or visitor restrictions in December. While the federal government funds aged care and the homes are in charge of resident care, it's state-based public health units that direct homes on how to deal with outbreaks, and that differs between jurisdictions.
So it's no surprise you end up with what we'd call diffusion of responsibility. There's no single person accountable and there's no single organisation accountable.
The body representing not-for-profit and charity aged care providers wants new guidelines from National Cabinet.
The way in which we've tried to prevent the spread of this disease has been based on good, solid infection control principles. But with Omicron spreading as widely as it can, we've got to recalibrate and do things differently.
We still haven't married the public health priorities with the human rights priorities.
In a statement late today, the Minister for Aged Care Services, Richard Colbeck, said 2 advocacy groups will work on a national proposal to reduce mental impacts of lockdowns on residents, with the aim of allowing more social interaction while minimising the COVID risk. Patricia Shea got COVID-19 at Newmarch House in 2020. She survived, but 17 other residents' deaths were directly attributed to COVID. An independent review commissioned by the Commonwealth found issues with infection control, leadership, communication, PPE and staffing in the period to June 2020.
Staffing levels are way worse than they were 2 years ago. There's been a mass exodus of staff in the sector, and Newmarch is no different. Very casualised workforce now, so at the moment they've got people doing double shifts, so managers on the floor doing works. The nurses and carers have to prioritise, and they obviously can't get through everything they need to in a day, so wound care gets a little rushed. Mum had a cut the other day that wasn't disinfected, so she had to call them back to do it.
730 put those claims to Anglicare, which operates Newmarch House. In a statement, it said the current COVID-19 situation was affecting its available workforce, an issue compounded by PCR test delays and a shortage of available rapid antigen tests. Providers estimate up to 50% of aged care staff across the country are being furloughed because they've got COVID or they're a close contact.
So this is really putting the care of older Australians at significant risk.
In 2020, Minister Colbeck announced surge workforce funding to provide temporary staff during outbreaks as part of a $100 million COVID aged care support package. In his statement today, he said that plan was filling more than 60,000 shifts. Providers say, despite such promises, there still aren't enough workers to go around.
The surge workforce is a fiction of Scott Morrison's imagination. It's a completely fake pageantry to make it look like there's the workforce of people here waiting in the wings. What we know is that many aged care homes today are not operating at safe staffing levels.
The Royal Commission also recommended pay rises for aged care staff to ensure high quality care and to attract more workers.
The Royal Commission's clearest recommendation was that we need to resolve the workforce crisis in aged care before we are going to see things improve.
So at the moment, we've been unable to pass on any substantial pay increase to our workers. We believe that is essential for actually getting a workforce into the future.
Richard Colbeck says the government is supporting the Fair Work Commission to make a decision on pay. Aged care providers say access to testing is another hurdle.
We are really urging the government to fix the problems of distribution of rapid antigen tests, personal protective equipment, and make sure that we can get staff back to work safely as quickly as we possibly can.
The Aged Care Services Minister says more than 5.5 million rapid antigen tests have been distributed to aged care, and homes with COVID-positive residents are being prioritised for PCR tests.
Oh, look at that.
They're little cocoa bottles.
Little booze.
Jay Siegel is 94 and has been living at Kawara Aged Care in Cairns for a year.
Oh, I used to have these when I was a boy.
So you've got to press one button on each side at a time. See?
Residents at his home had their second vaccination in April, but as case numbers started rising in Queensland this month, they hadn't had boosters. Jay's daughter-in-law took action.
To take him in a wheelchair in the middle of a heat wave and to get his booster shot, I felt like it should have been done by now. 2 days later, we received a notification via email that a worker had tested positive in his part of the facility and that they were having to go into isolation. So that, I guess, really made me a bit angry.
Oh, yes. They are nice photos, aren't they?
Jay spent 6 days in lockdown as the home waited on PCR test results.
He does struggle mentally with the confinement, I think, as anyone would.
Other residents at the home started getting their boosters today. Brooke Bannister's anger is directed at the federal rollout. Kawara Aged Care told 730 it would have liked boosters earlier if they'd been available from the federal government.
The advice we're getting every day from the Queensland Premier, from every health official, is as soon as you're due for your booster, at your 4 months, go and get your booster. And yet there are the most vulnerable in our community who are waiting 8 months after their second shot to get a booster.
The initial vaccine rollout was heavily criticised for being too slow to reach aged care residents. The booster rollout began in November, but so far more than a quarter of aged care homes are still waiting for their third dose.
We've had 2 goes already at getting it right, and we've had that experience and we still can't get the third time right.
Aged care staff are required to be double vaccinated. Some states have mandated the booster. The Federal Health Department didn't say how many workers have actually been boosted, but said staff are receiving boosters alongside residents when they're due, and extra booster hubs are planned.
We need a plan here clearly that shows us how urgently aged care residents are going to get vaccinated, but also the people in and out every day, the staff that work there, can't be forgotten in this too.
For Lisa Caponio's mum and the residents at her home, lockdown has now ended. But with an ongoing pandemic, fears for the most vulnerable remain.
My plea is please, at a national cabinet level, please review what is going on today in the facilities, be it public, be it private. It's irrelevant. It's irrelevant. They're our elderly people.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.